What's good, my inquisitive and sometimes pleasant anatomy heads? This is part 1 of my anatomy series. It's going to be a little more boring than the other ones because, it's the most general, basic information as far as anatomy and function. So what we're talking about specifically in this video, we're talking about my 10 out of 10 anatomical position and why that's important for understanding anatomy. But we're also going to talk about the key terms that are used to help navigate the body and understand what part of the body you're talking about. That's going to come into play when we're talking about origin, insertions, muscles, just everything. All right. So without further ado, let's get started. So boom, my 10 out of 10 anatomical position, right? This is kind of the foundation. This is what we always reference, right? When we're talking about functions, location, movement, always this position. So keep that in mind. And the words that we use to kind of navigate, well, the most basic, or the one that you're going to hear a lot, or the most possibly, is the word anterior posterior. And you always pair opposites together. It makes it a lot easier to remember. All right, so what's anterior? Anterior is just the front. That's all that really means. In this position, anterior. Posterior, exact opposite. It's the back. Then you have terms like superior and inferior, and all it is towards the top, superior, inferior towards the bottom, or in regards to a certain point, superior is just above the point, inferior is below that point. Now what about left and right and to the sides? Well, we got medial and lateral, right? So draw a line straight down, divide me into 2 equal halves, right? Ending away from that line towards the outside, it's gonna be lateral, right? Close towards the middle or midline is medial. So let's take a look at the pec, right? This is the half, the lateral half of my right pec, boom, that half. The medial half, boom, this half. You have internal and external, and it doesn't always have to do with layers, even though sometimes it can. But even more specific to layers are the terms deep and superficial. So let's say like we got 5 layers going on, right? The deepest layer is number 5. Well, let's say we're talking about layer 4. Layer 4 is deep to layer 3. Layer 2 is superficial to layer 3. The most superficial is layer 1 on top, right? So think about all the muscles you have around here, right? And when we talk about cephalic, you hear the word cephalic, that almost always references the head, so keep that in mind. Another super important one is going to be important for just bones, muscles, ligament, everything, just identifying things. It's proximal and distal. So what proximal is, think about it, the word proximity, close, distal, distance, far, right? Let's take a look at the arm, for example. The humerus, which is the upper arm bone, right? The proximal half is the closest half to you, right? Boom, proximal half. Distal half, boom, right here, because it ends right here and it meets the forearm, right? Or the ulna and the radius. Distal, distant, proximal, proximity, close. And we also divide the skeleton of the bones into kind of 2 categories. You have the axial skeleton, which is pretty much just the head and the trunk of the body, and the appendicular skeleton, which, as the name kind of implies, appendage usually means limbs, so the arms, the legs, all that stuff, right? Also, the axial skeleton protects all of your organs, right? That's another nice thing to remember. And now we also have ipsilateral and contralateral. So what does that mean? Let's use a muscle, for example. Our internal oblique on the left side right here does same side rotation. Another word for same side is ipsilateral rotation, right? So left one rotates to the left, ipsilateral, right? Contralateral is the opposite, right? So my external oblique, which is different muscles, does contralateral rotation. So if it's the left one, we rotate into the right. That's all that really means. And now let's talk about the head and the brain. Well, not too much of the brain, mostly just the bones of the head, right? Because this is going to be pretty important, and all your professors, teachers, they're going to ask you this stuff on the exam. And now we're moving on to the skull, right? So we're going to talk about the regions of the skull, the sutures, and kind of what each region represents, right? So you got the frontal region, which is right in here, forehead, frontal. And that frontal lobe is mostly responsible just for your personality, for what kind of makes you for logical decisions, problem solving, all that good stuff. So if people get lobotomies, they go crazy. They are not like they used to be, right? Brutal, I know. Then behind that, we have the parietal area, parietal region, parietal lobe, whatever you want to call it. It is right here. There's a suture that kind of comes across just like that. It's called the coronal suture. All that does is separate the frontal from the parietal. And we're gonna come here, kind of right to the base of the skull. Right here, you're gonna have another suture. It's called the lambdoid suture that separates the parietal from the occipital. And the occipital is, boom, right here, right at the base of the skull. Generally, that's associated with any kind of thing with vision, colors. How could I forget? I mentioned parietal without mentioning kind of what it's known for. Well, Kev, you also forgot to mention the sagittal suture, which separates the head and the skull into left and right halves. Right? So somatosensory, whenever you hear the word somato, always think body, right? People with psychosomatic issues or disorders, generally mental disorders that cause physical ailments or physical problems, right? So what's that really mean? Anything to do with temperature, taste, touch, determining if something is sharp. It just receives the information from your environment and kind of relays it to you so your body can understand it, right? And the last one we got is the temporal area, temporal lobe, whatever you want to call it, right? It's gonna be right in this area. And there's a suture that separates the parietal and the occipital region from this temporal region, right? That's called a squamous suture. And anything that has to do with the temporal lobe and its functions generally have to do with audio, understanding speech, right? All these lobes do a bunch of different things, but usually on exams, they ask you for these specific things, right? What they're mostly associated with. And this is pretty much it for the first video. Like I said, this one is gonna be a little more boring, a little slower. The next ones are gonna be good. We're gonna move on to each individual joint, what its functions are, the bones, the muscles, and get real in depth. We're gonna talk about the planes of motion and all that other fun stuff. But for right now, this is important to understand, especially if you're gonna be in, I suppose, this field that requires this knowledge, right? Or if you just wanna learn, hey, I'm here for that too, right? All right, my anatomy heads, this is the end of the video. I hope you guys liked it. Don't forget to like, comment, and subscribe to help me out so I can keep bringing you more juicy anatomy content. The anatomy that I'm gonna be going over is more geared towards like physical therapy, exercise, athletics, stuff like that. No organ systems or anything like that. So if that's what you're looking for, my bad, apologies. But until next time, guys, keep learning anatomy, understand your bodies, and mind your business. Peace.